Welcome to my channel by all animal lovers. I hope you all are doing well and your pets and your animal are in good condition. So today we would discuss ovariohysterectomy, which is the most common surgical condition we came across at clinic. Many of the owner have this complaint that their cat or dog usually remain in heat, so did this ovariohysterectomy surgical procedure to remove the ovary. So there is update on ovariohysterectomy. Use of efficient surgical technique during an ovariohysterectomy should prove beneficial for the patient, surgeon, and veterinarian business alike. Beautiful puppy. The most common performed surgical procedure in small animal practice in the United States or for reproductive sterilization. It is also called as spay and neuter. It is not only in United States but all over the world. Most common surgical procedure is the surgical sterilization of female dog and cat is commonly accomplished via variohysterectomy. In addition to sterilization, OV has significantly reduced the incidence of mammary gland tumors and is indicated for disease such as pyometra, cyst, and ovarian uterine neoplasia. An analysis of the veterinarian medical literature reveals four commonly used sterilization techniques: traditional midline, laparoscopic, flank, and ovarectomy, which will be highlighted in this update, often missing from surgical textbook, student teaching, and scholarly article or discussion on efficient technique that can be used when performing OVH. The authors highlight several efficient technique and other helpful method that can be used during OVH. I think this article is going to be very interesting and we are going to learn a lot of new things from this. So, review of traditional and modern OVA techniques. Traditional midline approach, which is common in practice by all the veterinarian all around the world. Veterinarian students are commonly taught, and many practicing veterinarian use a traditional midline ciliatomy approach of OVH. The incision is often one third of one half the length of distance between the umbilicus and pubis and can be extended in patients with ovaries or uterine body that are difficult to extrude. Example of these are deep-chested dogs. Traditional OVA technique include digital strumming of suspensory ligament, triple clamping and the ovarian pedicle, and double ligation of the ovarian pedicles and uterine body. Closure is often depicted as a standard three-layer closure. Laparoscopic approach. Laparoscopic OVH has been established as an alternative to the traditional midline approach and may have advantage. Example: reduce post-operative pain, reduce infection rate, and improve visualization of anatomy. It is three benefits of laparoscopic approach. Number one, you can visualize the anatomy of cat and dog easily, then reduce infection rate, and the most important is reduce post-operative pain. Potential disadvantages include the requirement for special equipment and training as well as lengthy surgical time. Surgeon must also overlook the lack of depth perception when performing procedure while visualizing a two-dimensional screen. A variety of specific techniques with difference in number and location of posts have been described. Flank ovariohysterectomy. In the United States, the standard approach for OVH of the cat is through a ventral midline incision, but here midline. However, in other countries, veterinarians prefer a flank approach. The flank approach has been recommended for cats with mammary hyperplasia, nursing queens, and feral cats. One obvious advantage is that the incision avoids mammary tissues. Another advantage is that for feral cats, the risk of heavy secretion in the case of dehiscence in less and the surgical wound can be observed without handling the animal. Ovariotomy. Ovariotomy is the surgical removal of both ovaries while leaving the uterine tissue intact. When performed properly, both ovariotomy and OVH result in permanent sterilization. The data vary with regard to length of surgical incision, surgical time, and potential of post-operative complication. In terms of risk, several recent articles have been indicated that risk of pyometra after ovarectomy or OVH is near zero. Mean The post-operative infections and post-operative pains are less is near zero if all of the variant tissue is removed because pyometra is hormonally dependent. Yes, it is right. Removing the ovaries almost completely removes the chance of post-operative pyometra. Efficient OVH technique, which we will discuss in the next video. Till now, like, share, and subscribe the channel.